picture something for a second. Close your eyes if you have to. Unless you're driving, please. Don't close your eyes if you're driving.
Good caveat.
So imagine a treadmill. Pretty standard piece of equipment. Now imagine that treadmill is submerged inside a tank of warm water.
Okay.
Still with me. Now standing on that treadmill, walking calmly, maybe even strutting a little bit, is a cat.
It sounds like a contradiction in terms, doesn't it? Or maybe, I don't know, a scene from a glitchy cartoon where the physics just broke.
Exactly. It feels like a glitch in the Matrix. I mean, my cat acts like I'm committing a war crime if a single drop of water from the sink hits his paw.
Right.
The idea of a cat voluntarily doing underwater aerobics just seems biologically impossible.
And yet, that is exactly what we are unpacking today. We are looking at a massive and, I think, really fascinating shift in veterinary medicine that is challenging everything we thought we knew about feline rehabilitation.
We are talking about feline hydrotherapy, and I want to be clear right up front, this isn't just a, spa day for pampered pets or some viral TikTok trend.
No, not at all.
We're looking at serious research here. We've got data from the San Marco Veterinary Clinic in Italy, case studies from specialists in New Jersey and Texas, and a specific study published in Applied Animal Behavior Science.
And the mission of this deep dive is really to debunk a very, very pervasive myth. The idea that cats and water don't mix.
Right.
Or, more specifically, the medical assumption that cats can't benefit from water therapy because the psychological stress would just outweigh any physical gain.
We're going to find out how veterinarians are moving from excluding cats from this life-changing therapy to successfully treating them. We're going to meet a paralyzed cat named Lola, who defied the odds.
It's an amazing story.
And we are going to learn about a surprisingly simple technique involved in the process called the damp towel method.
It really is a story about empathy as much as it is about medicine. It's about listening to the patient, even when the patient speaks a different language.
So let's dive in. Pun absolutely intended.
I'll allow it, just this once.
Thank you. Okay, let's start with the status quo, just to ground ourselves. If I have a Labrador that, say, tears an ACL or has arthritis, hydrotherapy is pretty mainstream, right?
Oh, absolutely. Underwater treadmills are commonplace in referral clinics for dogs now. It's a go-to for post-surgery recovery, neurological injuries, or just general mobility decline in older dogs.
Right.
We know the physics works.
Okay, let's pause on the physics for a second. Why water? Why not just have them walk on a dry treadmill? What makes the tank so special?
Well, it boils down to three main properties: buoyancy, viscosity, and hydrostatic pressure. Buoyancy is the big one.
Right.
It reduces the effective body weight. So a dog or a cat with a painful joint can move without the impact of gravity, slamming down on them.
It's like an anti-gravity suit.
Exactly. Then you have viscosity. Water is thicker than air, so it provides resistance. It builds muscle just by walking through it, but without the concussion of hitting pavement.
Okay.
And the hydrostatic pressure, that just helps reduce swelling in the limbs. It's a trifecta of benefits.
Okay, so the science is solid. But for cats?
For cats, it has historically been a non-starter. Just dismissed right out of the gate as impractical or poorly tolerated.
Is that because cats physically can't do it? I mean, their bodies work roughly the same way as dogs, biomechanically speaking?
Physically, they are perfect candidates. The benefits of buoyancy and resistance apply to a cat just as much as a dog. But the dismissal comes from the assumption of water aversion. Veterinarians know that cats generally have a very low threshold for stress compared to dogs.
Which is a polite way of saying they freak out easily.
Right. A standard vet visit, just the car ride and the cold exam table, is already high stress for a cat. Their cortisol levels spike. So the logic has been, if we take this already stressed out animal and put it into a tank of water, the anxiety is going to be so high that it cancels out any physical benefit.
It becomes a welfare concern. They excluded cats because they thought they were protecting them from trauma.
Exactly. It was a benevolent exclusion. But it meant cats with spinal injuries or severe arthritis were left with fewer options than their canine counterparts. They were effectively cut off from a modality that could help them walk again.
That makes total sense. You don't want to traumatize the animal you're trying to heal.
Yeah.
But you mentioned a new perspective coming out of Italy.
Yes, this is where the paradigm shifts. There was a study conducted at the San Marco Veterinary Clinic in Padua. Now, context is important here. This is a cat-friendly clinic with gold status.
What does gold status mean in this context? Is that just a marketing term?
It's actually a rigorous certification from the International Society of Feline Medicine. It means they are obsessive about feline comfort. Separate waiting rooms, specific handling techniques, diffusers with calming pheromones.
Ah, so they really get cats.
They really get the cat mindset. So the researchers, including a Dr. Stefania Uchidou and a Dr. Laura Sinigoy, they decided to challenge that exclusion. They proposed that the problem wasn't the water itself, but how we introduced it.
So they didn't just toss the cats in the deep end.
Far from it. They introduced a concept called behavioral habituation. Essentially, they stopped treating hydrotherapy as just a physical exercise, sets and reps, and started treating it as a behavioral process.
That's a key distinction. What does that mean in practice?
It means the primary goal, initially, isn't to build muscle. It's to build confidence. They took 12 cats with neurological or musculoskeletal issues, cats that really needed this therapy, and put them through a specific protocol designed to desensitize them to the environment.
And the results?
All 12 cats successfully completed the rehabilitation program.
Wait, 12 for 12? 100%.
100%.
That is wild. I would have bet money that at least one of them would have, I don't know, clawed their way up the walls or just shut down.
And that's the aha moment.
Yeah.
It challenges the fundamental idea that cats can't do this.
Right.
They can if we change the rules of engagement.
Okay, so let's unpack those rules. I need to know the how, because I'm listening to this and imagining my own cat. How do you actually get a cat into a tank of water without chaos? I'm imagining a lot of scratching and yowling.
Well, step one is surprisingly dry. The protocol starts with what they call dry exploration.
So no water at all.
None. The cat is given time and space to just explore the rehab room and the treadmill while it's empty.
I see.
They need to realize the machine itself isn't a monster. They let them sniff, walk around, and just relax in the environment.
It's about mapping the territory. Cats need to know their exits and their safe spots.
Exactly. If the environment is scary, nothing else works. Once they are comfortable with the room, they move to the next phase. But eventually, yes, you have to add water.
This is the part I'm skeptical about.
This is where that damp towel technique comes in. It's a brilliant little neurological bridge. Before they ever fill the tank, the clinicians gently touch the cat's paws with a damp towel.
A damp towel? That sounds way too simple to be a medical protocol.
It's deceptively simple. But think about the sensory experience. Going from bone-dry paws to standing in liquid is a huge sensory shock.
Yeah, that makes sense.
It triggers a withdrawal reflex.
Yeah.
By using the towel, they introduce the sensation of moisture and temperature in a controlled, non-threatening way.
It's like a handshake agreement with the cat. This is what wet feels like. It's okay.
Exactly. It primes the nervous system so the water isn't a surprise. And only once the cat is okay with that sensation do they introduce the water into the treadmill. And even then, it's just 2 inches.
2 inches? That's barely a puddle.
Just enough to cover the paws. The cat just stands there. They don't even walk yet. They just stand in the warm water to get used to the sound of the machine and the feeling of the liquid.
I have to assume there's some bribery involved here. You can't just ask a cat to stand in a puddle for the greater good.
Oh, absolutely. Motivation is key. The sources mention a young cat named Babaganoush.
Great name, by the way.
Isn't it? So for Babaganoush, who was highly food motivated, high-value snacks like churro or tuna were the key.
Yeah.
For other cats, it might be touch or play or just the presence of their owner. The owner stays right there to provide a safe base.
That safe base concept is interesting. It transforms the owner from a spectator into part of the therapy equipment in a way.
Yes. The cat looks to the owner to gauge the threat level. If the owner's calm and encouraging, the cat sees calmer.
So you've got the dry run, the damp towel, the shallow water.
What about when they're done? I know my cat hates the sound of a hairdryer. If you successfully do the swim but then blast them with a vacuum sound, wouldn't that just undo all the work?
You nailed it, and the researchers knew that. The protocol explicitly forbids loud blow dryers.
Ah.
The session ends with a low-stress drying routine using only warm towels.
The spa wrap.
Basically, they want to avoid creating a negative end-of-session memory. If the last thing the cat remembers is a scary noise or a blast of air, they won't want to come back next week. This all sounds incredibly patient. It sounds like it takes a lot longer than just treating a dog where you might just leash them up and go.
It might, initially. But this leads us to the most critical concept in this entire deep dive. Dr. Uchidou and Dr. Sinigoy emphasized that in this protocol, stress monitoring is a primary clinical parameter.
I want to dig into that. Usually clinical parameters are things like heart rate, blood pressure, range of motion, hard numbers.
Correct. In traditional physical therapy, you might push through a little discomfort to get a physical result. We're used to that no pain, no gain mentality.
Right.
But here, The cat's emotional state is treated as a vital sign, just as important as their heart rate.
So stress is as important as the injury itself.
Yes, it's patient-led therapy. They establish predefined stress thresholds using what are called FAS scores: fear, anxiety, and stress. They look for specific microsignals: ears pinned back, tail twitching, pupils dilating, freezing up.
And if they see those signals,
The session stops. Or they regress to a previous step. They don't push through.
the cat effectively has a stop button.
Precisely. And this prevents what's called sensitization. If you force a scared animal, they get more scared next time. Their brain wires the water to the fear. But if you stop when they ask you to stop, they learn they have agency. They learn they are safe.
That's so counterintuitive, right? By stopping more often, you actually make faster progress in the long run.
Exactly. The study found that over time, the observed stress behaviors actually declined. The cats got used to it because they knew they had control.
That's a powerful lesson even outside of veterinary medicine. But let's ground this in reality. We've talked about the theory and the protocol. I want to hear about the results. I mean, does this actually fix the cats?
Let's talk about Lola. This is a case study from Dr. Christine Conway, who runs Aqua Dog and Cat Rehabilitation in New Jersey. Lola is an 8-year-old spayed female cat who suffered a fibrocartilaginous embolism, or FCE.
Okay, translate that for those of us who didn't go to vet school.
Basically, a spinal stroke. A piece of cartilage blocks a blood vessel in the spinal cord. It happened suddenly. Lola was paralyzed in her rear legs, and even worse, she had no bowel or bladder control.
Wow. That's usually a devastating diagnosis. I feel like a lot of owners would be having very difficult conversations about euthanasia at that point. Incontinence is a major breaking point.
It is a very grim situation. But Dr. Conway didn't give up. She used a multimodal approach, e-stim, manual therapy, but a huge component was the hydrotherapy.
So why was hydrotherapy so critical for a spinal stroke specifically?
Because of the buoyancy we talked about. Lola couldn't stand on land. Her legs couldn't support her.
Right.
But in the water, she could stand. This allows the neural pathways to fire again without the load of gravity. It tells the brain, hey, these legs still work.
Did it work?
This is the best part. Lola didn't just survive. She regained function. And I don't just mean she could twitch a toe. She regained her litter box habits.
Whoa, okay. For anyone listening who has a cat, you know that litter box issues are life-altering. That is a massive quality of life metric.
Huge. And beyond that, Lola can now jump on furniture and navigate stairs.
From paralyzed and incontinent to jumping on the couch, that is incredible.
It really is. Dr. Conway notes she still has a mild deficit in one leg. She's not an Olympic gymnast or anything, but she continues to come in for maintenance visits.
Which proves she tolerates it long term. She's not fighting it.
Exactly.
Yeah.
She knows the drill. She gets in, she does her work, she gets a reward.
So hearing Lola's story, I imagine there are listeners right now thinking, could this help my cat? Maybe they have an older cat with arthritis or a cat recovering from surgery. Who is this actually for?
That's the big question. Dr. Conway outlines some criteria for a good candidate. And interestingly, the first criterion isn't about the cat at all. It's about the owner, a committed pet parent. This isn't a one-time magic pill. It requires multiple visits, often twice a week, for weeks or months. It requires patience, transport, probably some homework exercises. If the owner isn't bought in, the therapy fails.
That makes sense. It's a lifestyle commitment. And what about the cat?
The cat needs to be amenable to handling.
So if your cat turns into a buzzing chainsaw when you try to pick them up, this might not be the path.
Probably not. If you can't hold the cat to trim and claws, you probably can't put it in a treadmill. Though Dr. Conway did say, to date, we have not encountered a cat we could not handle. So never say never.
Huh. Challenge accepted, Dr. Conway. And what about medical conditions?
The best candidates are cats with osteoarthritis, IVDD, that's intervertebral disc disease, or obesity.
OPC makes a lot of sense. We see so many overweight house cats.
It's a vicious cycle. The cat is heavy, so its joints hurt. Because its joints hurt, it doesn't move. Because it doesn't move, it gains more weight.
And water breaks that cycle.
Exactly. They can exercise without the pain of impact. They burn calories and build muscle, which supports the joints, which leads to more movement on land.
Now, when it comes to measuring success, are we measuring thigh circumference like bodybuilders?
They try to. Dr. Jennifer Smallwood, another expert, notes that muscle mass measurements are great, but have you ever tried to use a tape measure on a cat's thigh?
I can't even get my cat to sit still for a photo, let alone a tailoring session.
Right. It's difficult and often inaccurate because the cat is squirming. So while they do look at muscle mass, the real measure of success is functional.
Functional meaning.
What can I do?
Dr. Ichidu calls it the restoration of species-typical
I
behaviors.
like that phrase. It sounds very scientific, but what does it look like in a living room?
It means, can they use the litter box with better posture? Are they grooming themselves again?
Oh, yeah.
Cats with arthritis often stop grooming their lower back because it hurts to twist. Are they playing? Are they less irritable? Less irritable is a big one. I think we forget that a grumpy cat might actually just be a cat in chronic pain.
100%. We assume it's personality, but it's pathology. Dr. Smallwood notes that behavior changes, like being more social, sleeping in the bed again instead of on the floor, are just as important as physical changes.
So success isn't just leg got bigger. Success is the cat gets to be a cat again.
That's the heart of it. It's not just about turning them into a medical patient. It's about giving them their life back.
So let's zoom out. What does this all mean? We've gone from a world where we assumed cats hate water, so we can't help them, to a world where a paralyzed cat is walking on an underwater treadmill.
It's a shift from exclusion to inclusion. We used to look at the barrier, the water aversion, and just stop there. We said, well, it's too hard.
Right.
Now, thanks to this welfare-first approach, we look at the barrier and say, how do we adapt the environment so the cat can succeed?
We stopped asking the cat to be a dog and started asking the therapy to be cat-friendly.
Exactly. By listening to the cat, by monitoring that stress signal as a clinical parameter, we unlocked a medical option that we thought was impossible. We realized that if we respect their fear, we can help them overcome it.
It really makes you wonder if we were wrong about cats and water because we were looking at it through a human lens or a dog lens.
Right. It raises the provocative question. What other limitations are we placing on our pets simply because we haven't asked them what they need to feel safe? What other impossible treatments are just one damp towel away from being possible?
That is something I'm definitely going to be thinking about next time I look at my cat. I might not put him in the bathtub just yet, but I'll certainly look at him with new eyes. Thank you so much for walking us through this.
My pleasure.
And thank you to everyone listening. We'll see you on the next deep dive.
Goodbye, everyone.